Greetings and welcome on behalf of the Gamma Mu chapter of Delta Omega to our annual sponsored Public Health Dialogue series. For those of you that are unfamiliar, Delta Omega is Public Health's honorary society, and it was founded in 1924 at Johns Hopkins University. When the WVU School of Public Health established our chapter in 2012, we created this sponsor speaker series specifically to honor alumni of our programs who have made significant impacts on a specific population through their work. Although today is April Fool's Day, our honorary guest this afternoon, Ms. Helen Matheny, who's sitting over here in the blue, is not here by accident, and Delta Omega is not pulling your leg. Ms. Matheny received her MS in Community Health Promotion from WVU and is current from 1997, and is the current director of the Alzheimer's Disease Outreach Registry program at the Blanchette Rockefeller Neurosciences Institute, a position she's had since 2010. Before joining the Neurosciences Institute, Ms. Matheny was the founding Chief Executive Officer of the West Virginia Medical Foundation, the educational charitable foundation of the West Virginia State Medical Association. In that role, she was instrumental in the passage of the West Virginia Healthy Lifestyles Act of 2005, that included a number of provisions related to nutritional guidelines and physical education requirements in schools. She also secured and administered more than $2 million in grant funding to implement the foundation's programs during that time. Other accomplishments include, but are not limited to, being a graduate of the Leadership West Virginia and former leadership of the West Virginia Board as chair. In 2005, she was also appointed by Governor Joe Manchin to serve on the West Virginia Healthy Lifestyle Coalition, and in 2012, she was asked to lead that committee as chair. And finally, Ms. Matheny was recently, most importantly, was recently nominated in our Gamma Mu chapter of Delta Omega. So please join me in welcoming Ms. Helen Matheny as our 2005 Delta Omega Gamma Mu chapter sponsored Public Health Dialogue speaker. Her passion for improving health of West Virginians is most deserving of our recognition. So that's without further ado. We will also have about 10 minutes after Ms. Matheny's presentation for question and answers. If you could please hold your questions until that time, that would be wonderful. And if you received an evaluation, please complete those, because those are important for our accreditation.
Thank you very much for that very kind introduction. Can everyone hear me? Okay, right there. And I want to welcome the folks that are joining us by web also. I'm delighted to be here. I want to thank the School of Public Health for the opportunity to be here and talk a little bit about Alzheimer's disease, our work at the Blanchette Rockefeller Neurosciences Institute, and really what is, unfortunately, a silver tsunami that's going to be facing our country and globally, in fact. So when I put together the title for our presentation today, you know, I saw, many of us have heard about the movie, Still Alice. How many of you here have read the book or have seen the movie? Okay, a few of you. So many of you, that's your assignment. You need to go see that, particularly those of you in public health and health sciences. My next question is, how many of you are public health students? We've got epidemiology and such like that. So I've got some opportunities for you. I'm going to point those out. But I think there are some opportunities for research and for just in improving the health of West Virginians and hopefully reducing the prevalence of a variety of chronic diseases and hopefully Alzheimer's disease as well. But as I thought about today's talk, I think that Still Alice has been a wonderful tool in helping to heighten awareness about Alzheimer's disease. You know, it was about 40 years ago that folks didn't talk about cancer, really. It was the C word, if you will. And it was kind of quiet if an individual had any type of cancer. And I think that's what we're experiencing today with Alzheimer's disease. People just don't want to talk about it. They don't want to either recognize or admit that they or their member of their family or loved one or friend has it. And that's very unfortunate. And I'm hoping that today's talk can help change that. We'll get into some of the specifics about that. But again, that's our jumping off point today, is to learn more about the disease, to learn what we can do about it, to learn how we can further research it and find maybe ways to prevent it. One of the key things that I do want you to realize today is that while Still Alice is a movie, it was a book, it's about a fictional character, there are thousands of people in West Virginia, 36,000, it's suggested by the Alzheimer's Association, that have Alzheimer's disease today. About 5.3 million across the country. And if we look globally, the numbers continue to grow. But the point that I wanted to make is that it affects individuals. It affects not only individuals, but this particular disease affects families. And so it's just not that a person has Alzheimer's disease, it's an entire family, and their friends that are impacted as well. And so in my family, unfortunately, my grandfather on my mother's side had Alzheimer's disease. And he was a very, very hardworking individual, a family man, and as a little girl, I always remember that he was a devout Methodist, and he liked Lawrence Welk, and he liked Billy Graham. But again, as we think about the disease, don't think of it as a category or group people together. And that's the point of Still Alice, I think, is those individuals may have Alzheimer's disease, but they have a lot of skills and qualities and characteristics that they can still contribute, and I think that we need to honor that. So for today's talk, here are a few objectives. We're going to talk about a few different things. We're going to talk about the prevalence of Alzheimer's disease. We're going to talk about the economic impact. We're going to talk about policy initiatives as well. And then finally, I want to leave you with a thought about dementia-friendly communities and how each one of us here and those viewing online can contribute and to help change to make West Virginia communities dementia-friendly. Here's just an overview in terms of Alzheimer's disease by the numbers, if you will. I've mentioned that about 5.3 million Americans have the disease, and again, that of individuals 65 years of age and older, there are about 36,000 in West Virginia. And again, you can see the statistics, but you may not know that it's the 6th leading cause of death in the United States, and the only one in the top 10 that can't be cured or prevented or the progression slowed yet. The other fact is, as I mentioned before, Alzheimer's disease not only impacts the individual, but families. Take a look at this staggering number. In terms of nationally, the number of hours of unpaid care for individuals with the disease, and then what the cost of that is to our country and to the community. And think about it too in terms of when I say that it affects the whole family, if you will. For a family member that has Alzheimer's disease, most likely it's the daughter, most likely it's the eldest daughter that is responsible for taking, for example, the parent to see the physician. And so that individual has to take time off work. They may need to come to work later. They may need to leave earlier. But that affects that family. So in addition, many families try to find help. I think it's pretty common, and I know experience in our family was, families like to keep their family members at home. And so this is an ongoing challenge in terms of finding quality care for individuals to come into the home and to provide that care. And so if somebody doesn't show up, for example, for their shift, then again, that falls back on a family member for them to care for their loved one for the day. So the other thing is, I think that as friends and as colleagues and as employers, we need to be understanding of those individuals who have someone with Alzheimer's disease in their family, that there's a tremendous stress, physical stress, mental stress, and even financial stress on those family members. And I think just as an example, when an individual is placed in a nursing home, it could be, what, $42,000 a year might be an average cost for nursing home care. So there are a lot of out-of-pocket expenses that we need to think about. So I guess to be considerate and compassionate and concerned about families that are dealing with Alzheimer's disease. So I get this question a lot in terms of what is Alzheimer's disease, what is dementia, etc. And I will tell you that the physician that I work with extensively, Dr. Shirley Nitsch from Marshall University, is a board-certified geriatrician, does a fabulous job at explaining this, and I hope I can do it just a little bit of the justice that she does to it. But Alzheimer's disease is one type of dementia. Dementia is the overarching global condition, if you will. And there are a number of specific diseases that are types of dementia. And so here you see a listing. Alzheimer's disease is probably the most common type of dementia. Probably 60 to 80% of dementias, according to the Alzheimer's Association, are Alzheimer's disease. So it might be the most common, the one you hear about a lot. Vascular dementia is, again, it related to the vascular system. For individuals that maybe have had many strokes or the TIAs, etc., then they may develop the vascular dementia. Mixed dementia refers to if there's a combination. Maybe you have Alzheimer's disease and vascular dementia. And then we can go on down through the list. Another way to look at this is through this wonderful graphic that Dr. Nitsch put together. And again, Alzheimer's disease is what we would consider going along a continuum. And so individuals have normal cognition, and then there's a progression, if you will, to this mild cognitive impairment. This is something that the scientists and others have identified as, again, along that continuum of the disease, is a mild cognitive impairment. And then it continues on to a type of dementia. And again, just to reinforce that, dementia is the overarching category, and then there are the specific types of dementias within that realm, with Alzheimer's disease being one of the most common. When we think about risk factors, there are a number of risk factors associated with Alzheimer's disease, with age being the most prevalent risk factor. And so unfortunately, by the time an individual gets to be 85 years of age or older, they have about a 50-50 chance of getting some type of dementia. And we'll talk more about that in a moment. Genetics and family history play a small part in it, if you will, and let me elaborate on that. There is a familial type of Alzheimer's disease, but it's a very, very small percentage. I would say 5% or less is that type of Alzheimer's disease. In addition, there's a family history. But I think that you'll see as we go along the talk that individuals, family members may have similar risk factors. For example, their environmental surroundings would be similar. And then those other risk factors, say if as a family they're overweight, they're smokers, maybe they're diabetics, that's where that family history, there's some common theme there, if you will. Some of the other risk factors, hypertension, and again, from reading the medical journals, this is the area that has, what I know currently, is the only grade A evidence in terms of a recommendation is to monitor and keep in control of the blood pressure. And you'll see more information about this, some of our data that we have related to blood pressure in just a moment. Educational achievement. And many people ask too that if I continue to learn and go to school and get an advanced degree, will that keep me from having Alzheimer's disease? And actually, again, what the literature says is that they think it's an individual's capacity to learn that reduces the risk of Alzheimer's disease. And the other element that I've read about that is sometimes they believe that an individual with advanced degrees has made more synaptic connections in the brain. There are more networks, if you will, that are connected. And so as you go through this progression of cognitive decline, it's thought that potentially the system reroutes itself, if you will. That's one consideration. Other risk factors may be diabetes, gender. We'll talk about that in a moment too, but unfortunately, ladies, we have a higher risk for Alzheimer's disease. And is that because we live longer? You know, it's thought that, for example, we know that typically ladies live longer because men die of cardiovascular disease or other causes. And so is this risk factor related to gender significant because we have more females who are 85 years of age and older? That's one thought. Another thought is that it could be within the genes, the makeup, the estrogen, et cetera. And so I will tell you there's a lot of interesting research, particularly in Massachusetts, related to women and Alzheimer's disease. As part of the Alzheimer's Facts and Figures report in 2014, last year, there was a whole section about women and Alzheimer's disease. So again, for the epidemiologists and folks in research here, this may be an interesting area that you want to further explore. And as I say, there are folks that are looking into this. It's very interesting work. Other risk factors, we know head injury. You've probably heard or read a lot about boxers, professional football players who have continuous head injuries, that they have a higher rate of dementia. And likewise, that we're seeing with traumatic brain injury. Dr. Bernie Shrews with the Institute is studying this with PTSD as well, and he can certainly elaborate on that, but that is one of those risk factors, as is Down syndrome and social isolation and physical activity. Now, on the flip side of that, I will tell you that I've read recently that there are reports that an increase in physical activity could very well help prevent or delay Alzheimer's disease. That's very recent, and again, for folks interested in research or epidemiology, healthy lifestyles, not only do these factors help with heart health, but possibly with reducing or the progression of Alzheimer's disease, something that we need to watch for further study. So these slides are from the West Virginia Alzheimer's Disease Registry. And again, I want to thank Dr. Bernie Shrews. He's the director of the registry, and he's here today. And again, public health students, seek out Bernie because he has a lot of fascinating data. And let me step back and tell you about the registry. The registry is password encrypted. It's a very, very secure database. And the state has mandated that healthcare professionals enter data in the registry about individuals who have been diagnosed with Alzheimer's disease. And so the type of information that is entered is, for example, age, other comorbidity, chronic conditions, educational attainment, is there a family history of Alzheimer's disease, et cetera. So this is a very rich database of information about Alzheimer's patients throughout the state. And Bernie was kind enough to pull some information, again, that I think in particular the public health folks are going to find interesting, is that along the side, if you can see it there, the percentage of Alzheimer's patients with a comorbid condition. And again, for those of us that have looked at, studied, or tried to prevent chronic conditions in West Virginia, you're going to recognize these diseases and are unfortunately high prevalence in the state. So you can see, again, in our orange section, diabetes, heart disease, hypertension, and hyperlipidemia are some of those areas where it's not uncommon for Alzheimer's disease patients to have those as well. Now, this is really interesting as well. I think that Bernie put together a slide in terms of number of other chronic conditions. And, a question that we might want to look into, and again for further research, is that, as we know in West Virginia, a lot of elderly people have these chronic conditions. Unfortunately, we have high risk factors of physical, sedentary lifestyle, of poor nutrition, of cardiovascular disease, diabetes, etc. So is it just coincidence? Bernie says no. So is it just coincidence that in West Virginia we have the aging population with a lot of chronic risk factors, and a lot of our Alzheimer's disease patients have multiple chronic conditions? But for the clinicians, this is something very important for you to think about. That if you have that Alzheimer's disease patient that is also a diabetic, for example, you might want to think about, are they going to be able to take the insulin, take the medication at the appropriate times? Are they going to forget to do that? Very, very important, along with heart disease and others, to think about for pharmacy, how do those medications interact, etc. So anyway, again, I think this is very fascinating, and I thank Bernie for putting this information together for us today. This is information in terms of our chronic condition. You see that the middle column is West Virginia, and the last column is how we compare to the United States. And again, as we come down, he's highlighted some areas where we're the same, better, or worse. But at any rate, again, for the public health students, we've got a lot of work to do in terms of promoting those healthy lifestyles, reducing those risk factors for cardiovascular disease, diabetes, cancer, etc. Here we're taking a look at the first risk factor that I mentioned in terms of age. We can see that it's possible to have Alzheimer's disease before the age of 65. That's early onset Alzheimer's disease. It's not as common by any means. You can see that it ramps up. And again, as I mentioned, we talked about the baby boomers. As the baby boomers age, we're going to see more and more people enter that age category, the aging of 85 plus. And so that's why we talk about this silver tsunami. The 10,000 individuals turn 65 every day in our country. And so we're going to see more and more individuals who are going to be in this potential category of getting Alzheimer's disease. This is a graph from Health Affairs. And Dr. Richard Hodis with the NIH, who heads up the Alzheimer's disease research there, pointed this out at a meeting. And basically what it shows is that right here, we're seeing the lines cross. The blue line is the age of individuals worldwide under 5 years old. The yellow or lime green line shows the number of individuals age 65 and older. Researchers thought these two lines would cross much later, maybe in 2020 or 2030. That's not the case. And so again, that's part of the silver tsunami and why we really have to ramp up our efforts to find a cure for Alzheimer's disease. Just very quickly, this is a slide from the Alzheimer's Association. And it may be a little difficult to read, but basically these are some early warning signs related to Alzheimer's disease. Memory changes that disrupt daily life, challenges in planning or solving problems. And this is, I can think of a couple of examples. As an example, you know how all grandmas are wonderful at preparing Thanksgiving dinner? This is a huge feat. I've done it before, okay? Timing is critically important. You've got the turkey, the mashed potatoes, everything. And it's very important that you're able to manage the time so that it hits the table at the right time, right? Well, this is something, and unfortunately, family gatherings, we're coming up on Easter right now as an example, that we may begin to notice that whether it's next Thanksgiving or whenever, is that grandma just doesn't have the timing down for Thanksgiving dinner like she used to. And first of all, it is a huge feat, but I will tell you, those are the types of signs and symptoms, not being able to balance the checkbook, normal routine things that you've done for years and years and years, and you're beginning to have some challenges or problems with it. If you drive to the golf course, every day in retirement and then suddenly get lost on the way home, those are types of things that are potentially warning signs. I get lots of questions about, what if I lose my keys? What if I can't remember somebody's name? Hey, you're okay, trust me. That happens to me all the time, okay? And I think I'm okay. But I will tell you, if you forget what the keys are for, then you might want to be concerned to be thinking about additional testing or consultation there. Again, here's just a summary slide about Alzheimer's disease. And I want to reinforce that Alzheimer's is the only cause of death in the top 10 in the United States that cannot currently be prevented, cured, or even slowed. And again, as I've emphasized, that we're going to have this silver tsunami. They're estimating by 2050, the number of individuals could well triple, nearly triple to 16 million. Again, West Virginia is not alone. We may be one of the oldest states in the country, but a lot of other states are experiencing an increase as well. Every 67 seconds, somebody in the United States develops Alzheimer's disease. Again, coming back to women in Alzheimer's disease, it doesn't look good for us ladies right now, but we're working for cures and we're working for ways to prevent it. And again, this is just a lot, I know it's a lot of verbiage for a slide, but it just talks a little bit more about women in Alzheimer's disease and why we have a higher chance of getting it. I do want to mention, circling back to women and caregiving, I mentioned that most likely it's the eldest daughter. There was an article in the Wall Street Journal just this week about Alzheimer's significant others. And it's a profile of 3 couples and the adjustments they've made within their lives to deal with Alzheimer's disease. Again, for public health folks, for primary care folks, I cannot emphasize enough the health of the caregiver. And here in the red is a source in terms of a caregiver stress checklist. It's important as individuals come into the office to ask the caregiver, how are you doing? Do you have support? How can we make sure that you've got the adequate support that you need? Along with that, I can't overemphasize resources that are available in the community. I'm going to talk about this a little bit more, but the Institute has put together a Connect to Care notebook. We have copies available that are free, and it's a great resource for caregivers as well. But I don't want to miss that opportunity to tell you that. Here we're talking about the number of hours that are spent, the number of dollars in terms of care, the high prevalence of depression for caregivers. So again, don't forget the caregivers. Support them in any way that you can. Talked about the physical, emotional, financial toll on caregivers. Now let's shift gears a little bit and talk about the finances. This doesn't look good either, I'm sorry to tell you. We can see that the direct cost to society in this current year, $226 billion. Half of that is Medicare. 1 in every 5 Medicare dollars is spent associated with Alzheimer's disease. By 2050, it'll be 1 in 3. I mean, this doesn't look good. As you all know, that we're on this track of Medicare, the healthcare costs are increasing already. And then when you add this additional patient load, if you will, and the healthcare costs associated with it, we're not on a very good track. Then you'll see that, again, an individual Medicare 3 times higher than the average per person costs. Individuals with Alzheimer's disease would be in and out of the hospital more frequently. This is an important issue for hospitals in terms of trying to reduce readmissions. That's something that we're looking into in terms of how can we better educate folks to reduce that. And again, this is just a graphic in terms of the purple is the Medicare costs. It goes from 2015 to 2050 on the right side. Yellow is Medicaid, out-of-pocket is green, and then the other payers is blue. Real briefly, I want to tell you about the Blanchette Rockefeller Neurosciences Institute, located across the street. Several of my colleagues and scientists are here today. I want to thank them for coming. And I told them all the hard questions are coming their way. But it was founded in 1999 in honor of Senator Rockefeller's mother, a nonprofit institute dedicated to the study of memory and memory disorders. And basically, we're working to find a cure for Alzheimer's disease. Here's a listing of all the memory disorders that the scientists research and explore. See a wide variety, as I mentioned, traumatic brain injury, Alzheimer's, dementia, Parkinson's, stroke, and partnerships that we have with health sciences in a variety of these areas to work together to address these diseases. We have three primary areas of the diagnostics, therapeutics, and the outreach program. Very quickly, the diagnostics, I think this is fascinating. The scientists are working on a skin test, and the idea is that one day you'd go to a physician's office, they'd take a small skin punch, send it off to the lab, and then they would tell if you currently have Alzheimer's disease. Because the thinking is if you have Alzheimer's disease in your brain, it's in those cells and it's systematic, and so it would be in your skin cells as well. We're working to validate this through autopsy and going through the clinical trial phases of this. We just need additional data to confirm, but right now the validation is accurate 95+% of the time, and so we know that we're on the right track there. Therapeutics, we have a very exciting journal article that was published this week in the Journal of Alzheimer's Disease. I'm going to just show you the link here in a moment. It's related to the PKC-activated bryostatin that Dr. Dan Alcons, our scientific director, is leading this charge. And the thinking there is that in the brain, when you have the progression of Alzheimer's disease, there's a breakdown in those synaptic connections. And so the bryostatin has proven to be effective in the animal models and in compassionate use trials to regrow those connections, or synaptogenesis. So, and the third piece is our outreach and registry program that I work with physicians throughout the state. Dr. Shirley Nitch, again from Marshall University. We hit the road and we do a number of programs to help improve the screening, diagnosis, treatment, and care of people with Alzheimer's disease. Here's a listing of some of the lectures that Dr. Nitch provides. And we try to be very responsive to what the needs are. We listen to what the questions of physicians, nurses, social workers, et cetera, and then develop those sessions to help meet those needs. We also work with the State Medical Association and put together a single-issue journal related to Alzheimer's disease, and folks were able to get 7 hours of CME by reading all the articles and taking the quiz. This is the brand new this week, the journal article from the Institute and Marshall University, the Journal of Alzheimer's Disease, and you can go online very shortly to see this article. Talks about a compassionate use trial here in West Virginia. Okay, we're shifting into another area now related to policy work. And because members of Congress realized this wave of the increase in prevalence of Alzheimer's disease, back in 2010, Congress passed the National Alzheimer's Project Act. And this is the first time in the nation's history that the federal government brought together, focused on Alzheimer's disease. And it called for a national plan. It also called for the establishment of an advisory committee to make recommendations to the Secretary of Health and Human Services and to members of Congress in terms of what should we be doing related to Alzheimer's disease. The plan has 5 ambitious goals, and I will tell you this first one is bold, but necessary, and some say not urgent enough. There was a lot of discussion within the committee about maybe we should set the goal at 2020 to find a cure. But we want to make sure that research is a priority area, clinical care services is a priority area, and long-term services and supports are being addressed. So, as I mentioned, that part of this Project Act called for an advisory council. And I was very honored to be appointed to the advisory council back in 2011 by Secretary Kathleen Sebelius, one of 11 members, non-federal members from across the country who bring a voice to the advisory committee. And I will tell you that I'm, again, honored to serve on this committee with some extraordinarily talented professionals. Dr. Ron Peterson is our chair. He is also the chair of the Mayo Clinic Alzheimer's Disease Research Center. He's been on the National Alzheimer's Association board. He, along with George Vredenberg and Harry Johns with the Alzheimer's Association, serve on the Global Dementia Council. And again, this is very, very exciting. Just within the last year, we've seen more activity at the global level. Prime Minister David Cameron was leading the charge as Prime Minister of England in terms of highlighting it on a global level. You may remember that the World Health Organization had a HIV/AIDS focus years ago. Thanks to David Cameron, they've had a World Dementia focus. They have a council and they meet regularly. And in fact, they just had a legacy meeting in Bethesda recently. But at any rate, what they're trying to do is to bring together researchers, activists, and professionals from around the world to learn from one another and to work to address this. I will tell you, too, that I'm extremely proud because out of this list of about 20 folks, 2 are WVU Health Sciences graduates. And I think that's pretty cool for West Virginia to be recognized at the national level. The other thing I will tell you is that I encourage input, suggestions, feedback related to the council. I serve on the clinical care committee of this group, and so there are about 6 of us that serve in this capacity with folks from CMS, HRSA, etc. And we put forth what I think are bold recommendations in terms of how the nation should be addressing this. And let me give you an example. One of the things that we wanted to do is to make sure we had the best trained healthcare professionals. And so we wanted to make sure that these professionals had the skills, competencies, and knowledge that they were very well prepared to treat the patients. And so we recommended a unified primary care disease curriculum that's in the works now. We have an expert panel we've been working, it'll be an 18-month process, and we're putting forth recommendations in terms of what should be included in that curriculum. Another piece is Redesign Medicare coverage. And out of this recommendation, now there's national legislation that has been proposed. It was proposed last year, and then just last week when I was in Washington for the Alzheimer's Advocacy Forum, 1,100 people from across the country were there. Our Senator Shelley Capito was one of the originating co-authors of the HOPE Act. And what that means is if this goes through Congress, then physicians will have a code to be able to be reimbursed for their time that they're spending with patients, family members, for education about Alzheimer's disease, about available resources, etc. And so we're right on track. That's the type of work that's happening in advocacy and policy that we need to continue to do. And if you get a chance, thanks Senator Capito for her efforts there. And I will tell you, we had a visit with Senator Manchin, and he is very supportive as well. If you want to know more about the national work, here's the website. I will tell you that the 2015 update to the national plan will be out early May, and so you can see what the recommendations are there. The other thing with the national plan, I think it's a helpful guide. It has links to a number of resources for, again, education, research, etc. I'm not going to spend a lot of time on this, but this is a new report from the Alzheimer's Association to plant the seed of what if we were able to find the cure? What if we were able to reach the first national goal? And it's, I want to get to this. We can see the reduction to Medicare and Medicaid. Right now, the nation spends about $536 million for Alzheimer's disease research. When we were in Washington last week, we asked for an additional $300 million on top of that. Our goal from the national plan is to hit the level of $2 billion with a B. We really need to ramp that up, so we're taking a significant step there. But here's the graph that I wanted to mention in terms of, this is the trajectory that we're on now. If we're able to find a cure by 2025 to slow down the progression, here you can see that where we would be in terms of the number of cases of Alzheimer's disease and the impact that it can have on patients and families. And so that's why we really need to have an urgency to make that happen. Again, just in the latest research, the folks at the Mayo, this is from the Mayo Clinic, but what they're considering now is that, again, along this continuum, individuals may have begin developing Alzheimer's disease, or those amyloid deposits are happening back here. When you look at dementia, that's when the cognitive impairment is progressively worse. Mild cognitive impairment is the step before that. And so what they're seeing, or what they're thinking now, is they want to focus a lot of work here, again, to try to prevent or slow down. Again, that's the work that's happening at the Mayo Clinic and others, but it's an interesting thought. Again, I mentioned resources. I can't emphasize enough that as families, clinicians, and others are looking for areas where to turn for help, just this week, the NIA, the National Institute on Aging, released great resources. So you can find those online. Local resources. I can't emphasize enough, the Alzheimer's Association is a very valuable resource in terms of learning more about Alzheimer's disease, learning about the progression of Alzheimer's disease, because every case is different, and finding about local resources. Again, the Connect to Care Notebooks has this list and a more extensive list in it about resources that are available. And I want to mention in particular the Center for End-of-Life Care, Dr. Moss and Cindy Jameson, wonderful partners, great resources to help families in terms of that, the advanced care planning piece. We have copies here. If you want more copies, here's the phone number at the Institute to call to get your free copy of the Connect to Care notebook. In the notebook, you'll see an area for a listing of all the physicians that the patient sees. You'll see a place to list current medications, because that changes a lot. You can put lab reports in there, etc. The idea is that one individual may not accompany the patient every time, or you may have a question that you want to ask the physician. Jot it down in the notebook and it's all there. It's trying to be a helpful guide. Okay, excuse me. As we're wrapping up, I want to talk a little bit about dementia-friendly communities. And again, the idea here is to create a safe, compassionate community for people to live their best life in, if you will. This effort is really taking off in Minnesota, and so that I'm more or less using their work as a guide. You will be hearing a lot more about it at the national level. We're going to be talking about this to perhaps do pilot programs throughout the nation. But this is what we're talking about. And to kind of put this into practice, this is what it would look like. In terms of early diagnosis and quality care, having a well-trained primary care office, clinic that knows about diagnosing and referring to the appropriate care. think about if you had clergy and other in churches and synagogues that would be welcoming of and supportive of individuals with dementia and those caregivers and family members. An example that I think really hits home is think about in a banking situation that, you know, you're a bank teller and typically you see Mr. and Mrs. Johnson come into the bank and, you know, before long you just see, you know, Mrs. Johnson come in and she may be in a hurry or whatever to make that transaction. Well, it might be because Mr. Johnson is still in the car, you know, and she doesn't want to leave him long. So I think it's really, really important in terms of raising awareness about this disease to be informed and compassionate and supportive of those individuals with Alzheimer's disease. And that's the whole idea, is to be able to support those individuals and to be active and involved within the community. So finally here, in terms of healthcare settings, this is a 6-step process in terms of a clinic or primary care office in terms of how can they be better equipped to be dementia-friendly, to get the training. And again, our outreach program offers that training. If you want us to come to your facility or learn more about it, we're happy to do that. I have my contact information here and be happy to do that. Again, use those clinical practice tools. We'll have that national curriculum out soon. But again, the National Institute on Aging has guides for primary care practitioners in terms of how to do the assessment. How do you rule out a vitamin B12 deficiency or thyroid, et cetera? How do you make that accurate diagnosis? And then finally, making sure that the primary care practice makes those referrals to local communities and services, because I think that's a critical piece. Until we find that cure, what I've experienced is families need to know about those supportive resources within the community that are handy. So I think it's really important for those dementia-friendly healthcare settings to have that information. Okay, so wrapping up, I want to leave you with a couple of thoughts. Again, last week in Washington, Lisa Genoa received an award, the Eunice Shriver Award for Humanitarian Activism or something like that. And I had the opportunity to meet and talk with her, but she says, and I want to read this if you'll let me, because she's so good about expressing her thoughts here. But she says, my Nana had Alzheimer's. She was diagnosed when she was 85. She always had an incredibly smart, independent, capable of anything. I watched helplessly and brokenhearted as she forgot who her family was as she chatted with a stuffed animal named Henry. As she got lost in her own home, she couldn't recognize her own face in the mirror. As the neuroscientist in my family, she says, I read everything I could to better understand my Nana's Alzheimer's. While I gained an understanding of the neuroscience of Alzheimer's and the perspective of the caregiver, I couldn't find a satisfying answer to the question I most desperately wanted to know. And that question is, what does it feel like to have Alzheimer's? I intuitively knew two things. Understanding what it feels like to have Alzheimer's was the key to staying connected to my Nana. Literature is a place where we can explore empathy, where a reader can walk in someone else's shoes. What does it feel like to have Alzheimer's? This question was the seed for Still Alice. And again, she concludes by saying, in doing the research for Still Alice, I came to know 27 people living with young onset or early stage Alzheimer's. I was touched with many of these people through email, through a live online chat, or by phone every day for a year and a half that I wrote the story. When I was brainstorming a title for the book, I searched through the hundreds of email conversations with these friends living with Alzheimer's and was struck by the word still in every single email. I'm still here. I can still play the mandolin. I still matter. I still love my family. And so there was my title. And again, I want to leave you with this thought as well, is that I want to thank you for coming today, for learning more about Alzheimer's disease, and that each of us in the room can help be more compassionate, understanding, help to find a cure, help find ways to prevent it. And we can also help reduce the stigma of Alzheimer's disease. So again, I want to thank you, and here's my contact information. If you have ideas or suggestions or feedback that I can take to our advisory council in the clinical care space, please let me know. And again, thank you all very much.
A little time, anybody wants to answer any questions or ask any questions.
Hello.
Hi.
Great presentation, by the way.
Thank you.
But I saw the movie Still Alice, and I really enjoyed it. And something that caught my attention was in the movie Still Alice, it seemed like her education, because she was a doctoral level, it seemed like that was more played as a risk factor, and in your presentation it was shown as a protective factor. And I'm wondering what your opinion is about that, and also would it be like a risk factor in the movie because maybe it just caused the diagnosis to be later on, so it seemed like she was decreasing faster, or what your thoughts are?
That's interesting. I didn't get the same idea that her level of education was a risk factor. That's not how I took it away. But I think the thing that really spoke to me in the movie related to that was her identity. That as a professor and as an accomplished individual at the doctorate level, that was her identity. And in terms of communication was her world. I think that was hit home a lot in terms of not being able to express yourself, and as that disease progresses, that you lose the ability to communicate effectively. And she would even say, remember how many times she would say that? She would say the phrase, that word's hanging out there. And it's hanging out there, and she just could not articulate that. So I thought that was really interesting how that was her occupation. Yeah, thank you.
My question is that I've always heard that Alzheimer's kills, and it's one of the leading causes of deaths, but I've never really heard how it does this, so.
Right, so let me take a stab at this. So as the disease progresses, it may start in the area of the brain where short-term memory or memory is located, and then those neurons die, if you will, and then it just progresses throughout the brain to the other control centers, if you will, of swallowing, of breathing, and so the bodily functions, your motor skills and things like that, it slowly progresses to affect those neurons that control those functions in our body.
This is going to be our last question. We have to be out of here in a little bit.
Thank you. Clearly an important topic. Thanks for the interesting presentation. At times you were using dementia and Alzheimer's interchangeably. It seems to me that a big component of at least some forms of dementia is going to be substance abuse. We have an awful lot of substance abuse in this country, and in West Virginia, along with New Mexico, leads the country in terms of overdose death rates. Psychoactive drugs, by definition, target the brain. If they're being abused, they're going to damage the brain, they're going to attack the brain. So how do you view that as a risk factor in what you're interested in?
Okay, let me first address the Alzheimer's dementia thing, and that's probably my mistake. Many times through our work we talk about Alzheimer's disease, what we really mean is Alzheimer's disease and related dementias. And so I apologize for confusing you on that piece. But I think that's an interesting aspect in terms of substance abuse. You know, I know that alcohol use could potentially be a risk factor, if you will. And again, that's interesting because of substance abuse affecting the brain. I'm not aware of any particular studies associated with that, but that's something that we could definitely look into. It's quite a possibility.
I mean, the good news is if substance abuse is actually causing a lot of this, if that can actually be addressed or people
Right, prevented.
avoiding abusing substances, that should in turn affect the death rates later on.
Yep.
Whereas if it's genetic, then, as with Alzheimer's, you need an autopsy
Right.
to validate it and all the rest of it. Genetic solution would be different from the behavioural, I suspect you need.
Right, right. Thank you.
I'm sorry, we have to wrap it up here now. If you have any additional questions, is that okay? Please just, we'll have some more time with Helen afterward. Thank you for coming, and have a great day.